I've got a Gasquy, Media Relations Coordinator here at Children's of Alabama, joining you today with a COVID-19 Zoom panel. Two of our doctors here at Children's. I'm going to give them the chance to introduce themselves, and we'll talk a little bit about what the doctors have seen from the Delta variant, some various back-to-school advice, the importance of vaccinations. We thank so much for your time today. Dr. Gigi Youngblood, we'll start with you. Tell us a little bit about yourself.
Hey, so I'm a general pediatrician out in Trustful at Pediatrics East, and I have, pertinent to our conversation today, I have an 11-year-old daughter and an 8-year-old son, and we're going to talk a lot about stuff that affects them.
And also Dr. Peily Soong. Doctor, thanks so much for joining us. Tell us about yourself a little bit.
I'm also a general pediatrician out in Trustful as well with Dr. Youngblood, and I both practice together at Pediatrics East. I too as well have two young children. I've got a 12-year-old and a almost 10-year-old as well.
So one of the big topics that a lot of people have been talking about lately, the Delta variant. It's something that, a lot of people are asking questions about. And one of those questions is how it's different from some of the other variants that we've seen beforehand in this process. Dr. Youngblood, tell me a little bit about what you've kind of observed from the Delta variant.
So, we're still learning. I mean, we're just in constant flux in terms of what we know. But what we're seeing is that this does appear to be different in the way that it affects children and young adults as well. So one of my best sources of information is my colleagues in Missouri and Arkansas, Texas, Mississippi, places that have been harder hit by Delta. And they are telling me that they are definitely seeing more hospital admissions this round of COVID than in previous waves of surges of COVID around the country. Particularly, I'm talking about my pediatric colleagues. So their hospitals are more full than what we've seen. And as a pediatrician, for me, that's very concerning. And I think that everybody needs to be aware of that and needs to be making decisions, not based on what we did, last summer, last winter, but realizing that, we might be dealing with sort of a different beast from a pediatric standpoint.
And I know there's been also some talk about how, some of the previous variants, we didn't hear as much about them in children, but perhaps the Delta variant might spread more quickly in children. Dr. Soong, is that an accurate assessment to your knowledge?
That's what we are afraid of right now. Again, we're still learning about this variant, but it does appear to be more contagious, easily spreadable, have more virus particles, and when you do get infected, which a lot of times can lead to more transmission. And so, like I said, we were still learning about it, especially in kids, but this is one where we've actually started across the country. We've really worried about children, when previously, while kids were getting sick with it, it was not nearly as much as the adults. And but this one, it does appear to be affecting children more and young adults as well. So that includes parents and stuff. So this is still relevant to parents and stuff too, because if a caregiver gets lost, a parent is lost to COVID, or has to be hospitalized for COVID, that affects children, of course. And so our message is not just about children today. It's going to be about adults as well, because these are our parents of our kids that we're taking.
And obviously the start of school is not that far away. Parents have a lot to think about right now. Dr. Youngblood, what are some of the things that you want parents to know about COVID-19 as students prepare for in-person classes this year?
Just reiterating what I said earlier, I don't think that we can make the same assumptions about this that we made last year. I think we need to be realizing that we might be dealing with, a different version of this disease. So I want parents to realize that every parent needs a plan. Your school needs a plan. Winging it is not, in my opinion, counting as a plan, hoping for the best. That's not a plan I would choose. That's not one I want educators, administrators to choose for our children. So I think we need a plan based on evidence-based guidelines. The CDC and the AAP have been giving us really excellent guidance. It's changing, and I know that can be frustrating when you are a decision maker, and it's frustrating when you're a parent, but it's changing because the landscape of COVID is changing. The virus is changing. And so, we have to be willing to be flexible and to pivot into a direction that's going to keep our kids safe.
Dr. Soong, how important is it for parents as we get closer to the start of school to really do research and pay attention to the information that is out there about how to keep their kids safe?
Oh, it's very important because I think, unfortunately, a lot of the school systems here in Alabama are not going to be following guidelines. They're going to not be requiring masks in school as recommended by the CDC, by the AAP, and by lots of pediatricians across the country and in our state and in our city. And so it's important for parents to keep up with what's going on, because unfortunately, a lot of the decisions being made in schools and in our communities are politically motivated, and we really shouldn't be. Science is science, and it shouldn't be politically motivated, and we really need to be aware of what the data is showing, what the recommendations of the people that are making the recommendations are saying. And so parents need to be aware of, just because my school says, oh, it's fine to not have masks in school, it may not actually be scientifically appropriate not to send your kids to school without a mask.
And obviously, vaccinations are another big topic, and a decision that some parents, if they have kids of a certain age, will have to make about whether or not they want their kids to get vaccinated. Dr. Youngblood, what would your advice be to parents about making that decision?
So in general, with very, very few exceptions, I really want my patients who are 12 years and up protected against this virus, and the vaccination is our best option. It's the most effective option. Unfortunately, it's not an option for our younger patients, but we're working on that. If a parent has specific concerns, first of all, as pediatricians, we hear lots of concerns about vaccines. We understand that it's scary to make decisions as a parent that will affect your children. So I would really, really encourage parents to reach out and talk with their pediatrician if they are hesitant about the COVID-19 vaccine. But as a general statement, I would strongly support the vast, vast majority of children taking advantage of that opportunity to avoid, this terrible virus.
Dr. Soong, how much of a difference can vaccinations make in the way that this school year plays out and the health of children across Alabama?
Well, we do know vaccinations, while there are what we call, or what the media is calling, breakthrough cases where the vaccine isn't preventing symptomatic disease, it is preventing hospitalizations. The vast majority of people being hospitalized are unvaccinated, as most people have probably heard already in the news. But that is really important. The goal of the vaccinations to start with were to prevent hospitalization, to prevent serious illness. It was not necessarily to prevent symptomatic cases or mild cases. We were fortunate that the vaccine initially on was very good against preventing symptomatic cases, and with the initial virus and with some of the subsequent variants. But this Delta seems to be breaking through the vaccine, but it still prevents you from getting really sick. And again, I stress that everybody needs to go out and get their vaccines. 12 and above need to get their vaccine. We are seeing kids in the hospital getting COVID. We're seeing parents getting hospitalized with COVID. All those things can affect children. now in the short term as well in the long term. If a parent dies, again, if a parent dies with COVID, has serious long-term effect from COVID that affects children and how they grow up.
You mentioned the breakthrough cases and that possibility, and I'll let both of you answer this. Because of that possibility, do you think it's important even for people who have been vaccinated to make sure that they're still wearing masks?
I do. I think because there can be some breakthrough cases, and because of our vaccination rates are so low right now in our state, and as well as children under 12 can't be vaccinated. Even if you're vaccinated, you have a mild illness, you are still able to pass it on to somebody else. You're able to pass it on to your younger kids. You're able to pass it on to your younger kids' neighbors in carpool. So it is still important for you to wear your mask when you're around other people, especially indoors as well too. So masking is now becoming back to where even if you are vaccinated, you really should be wearing a mask.
Dr. Youngblood, what are your thoughts about masking for people who are vaccinated?
So I think it's been, confusing if so much of the recommendations that have been made, there's a lot of nuance there. And I think it's confusing when, 2 months ago, the recommendations are, oh, if you're fully vaccinated, you don't need to wear a mask. But what we just have to keep focusing on is that this is changing. And so the recommendations are going to change in real time, and they should, that's appropriate. So I think when people said last month, you said I didn't have to wear a mask if I were vaccinated, and now you're telling me, that I do, that's why. It's because the virus is changing, and if we don't change in response to that, it's going to be really, really bad. And so we have to stay on top of these things, and we really, really need our parents and our patients to be flexible, just like we're having to be flexible as we learn new things. And so the masking would definitely fall under that. But I understand it's confusing, and it does seem like, everything's going back and forth and back and forth. And what do I believe today? And that's where your trusted pediatrician, your trusted family doctor can play a really important role helping you sort all of this out. And there's so much bad information out there. So please be careful about your sources. And again, when in doubt, this is what we do. This is bread and butter pediatrics. We want to prevent diseases. That's our favorite thing to do, is not treat. Once they're sick, we like to prevent. That's why I went into pediatrics. So I would love to talk to families if they have some confusion about all of this.
Very important for parents to speak with their pediatricians, like the two that we have here today. Once again, Dr. Gigi Youngblood and Dr. Peily Soong. Thanks so much for your time, and thanks to everyone for watching. That'll do it for our COVID-19 Zoom panel.